was in and out until the age of 12. When he re-entered, he did not leave again until he was 17. He was placed in just about every type of facility, from foster homes to group homes and detention facilities. Jacob potentially entered the system as an abuse and neglect case, which then turned into a delinquency case. He obtained his GED at the age of 17 and now works full-time and attends Metro Community College, pursuing a degree in social work. Sorry. And then I would like to introduce Kate Hanley. She is a consultant for the National Resource Center of Youth Development and has combated state foster care directors, to determine the challenges and success implementation of education nationally. Kate worked for the Michigan Department of Human Services for 30 years and served as a permanency director within the Children's Service Division. She facilitated the statewide task force for youth transitioning from foster care and the National Governance Policy Academy team for older youth in foster care, culminating in a report to the governor with 21 recommendations for improving services.
Good afternoon. I'm glad we finally got the PowerPoint moving, but I'll have to talk a little fast to keep us going. I'm going to start out with some short overview of the Fostering Connections Extension of foster care, what's involved in it, and what states are doing. And a follow-up of my giving information will be the reality of the situation, which will be presented by Jake from his own experience and from what he's heard from other foster youth. So this is perhaps, in my mind, one of the most important changes in foster care in the last 30 years. As a state director in Michigan, when the instructions came out for this program in 2010, we felt it was Christmas in July. It was like a very flexible sort of instruction from the federal government that states could be innovative, they could do some different things, they could really try to make impact for young adults 18 to 21. I certainly never thought it would happen and was more than surprised by how they were going to run this. So basically, this program is for young people 18 to 21 who are in foster care under the responsibility of a 4 agency. And then if those youth in foster care. And then if the state does implement this program, they also have to extend subsidy for young people from foster care who were adopted or went into guardianship, and that extension would go to 21, but only if they were adopted or went to guardianship after the age of 16 or older. So it's a very small group, but they didn't want people to not adopt or take young people into guardianship, because it would be better for them to stay and have all the benefits. So they extended the subsidy, which is really essential. And the other thing that the agency has to do, and it's a sort of an odd thing, is just they have to make the legal definition, so to speak, of child to 21. And the reason for that is somehow you have to keep this group of young people in the child foster care system, welfare system. So you have to define them as being in there. So it's only for this group, it doesn't impact any other young people in the state, just to keep them eligible for this program. And then the requirements remain the same in many ways for this group, as far as there's an annual permanency hearing to make sure the state is working towards permanency, unless the young person is in foster care under a voluntary agreement, and we'll talk a lot more about that. And then the case to make sure there is a monthly face-to-face caseworker visit that has to be held, and the young people are Medicaid eligible to 21, or unless the state doesn't go to 21. And the other very good thing is that when a young person is in foster care and has a child, that child is eligible for the cost of their care, and they're also eligible. And the big difference on that's always been true, but now if that young person is living in a supervised independent program, or like an apartment or a dorm, and that child's living with them, that child is covered. That was never true. They used to have to be in a licensed placement. So it's really still important that we do permanency for these young people at all times. Sorry, I missed that one. And continue to work for that, even when they're older youth. We still want to make sure they have a network of connections and some permanent relationships in their lives. So then the other requirements, I've covered those. The other state options out there for this program is that you can go to 19, which is what Nebraska did. You have implemented this program until 19 in some ways. And the conditions of eligibility are that they could be in secondary education, post-secondary, vocational, any type of career preparation, employed at least 80 hours a month, or they are incapable, either medically or for some reason incapable of doing those activities. So it's not like we're just saying you can stay in foster care or whatever we would call that care after 18. It's you also have to meet certain conditions. So you have to be employed or in some type of schooling if you're going to be in this program. And so they have, the young people also have expectations. And there are some other options that we're going to go into further, and Jake will have some input on those. One is if you use a voluntary agreement after 18 or 19, whether you allow reentry or trial independence where the young person can leave and come back. And then there's a change in what are approved living arrangements that federal funding for foster care. That's all they've ever covered, and that is now expanded. And then now that maintenance payments for these young adults can go directly to the young adult is a change. So nationally right now, this really is moving pretty well. There's 14 states with approved plans, and that means that they revise their state plan, send it into, to get it approved, and it has gone all the way through the approval. 12 of these states extend foster care to age 21. California started in this sort of staged type of implementation where they started with 19, then 20, 21. They've run into a lot of hassles with that, but they will end up at 21. And you have gone to 19 here. And basically you were already at 19, and this is a way that you could expand those young people who could get 4A funding until 19. So that's why Nebraska did that. It was an easy way to start that funding and flow into the state. So when I talk to Nebraska, they usually say, well, we didn't implement yet. But in fact, you're recognized as having implemented it. And then there are still states that are working on these, on this extension, actively discussing it. A few I know of are West Virginia, Michigan, and Indiana. Michigan has implemented, Indiana has implemented already, but they haven't got the approval from the federal government yet. They haven't got their plan approved yet, but they've already implemented. And West Virginia, Michigan are until 21, and Indiana until age 20. So the vast majority are going to the maximum age of 21, which is a great thing. So for the eligibility conditions that I told you about, the different types of education and work expectation, 12 of the states have approved plans with all 5 of those conditions, including all of those ways to become eligible for the young people. Washington State is limiting that to just those young people in secondary education. And Tennessee at this point doesn't include the employed 80 hours a month, although that's in their legislation, so they can add it when they want to, and hopefully that's soon. And with Michigan and Indiana pending, they're doing all of them. West Virginia is also secondary and post-secondary, more the school, not the employment. And one of the big issues for that is that any of the states, and there's a number of them that had a fairly robust program till 21, but it's traditionally been for only those kids going to college or some type of education. that leaves out a huge number of the foster youth. And it really puts sort of a specialized group that's going to get that support. I'm hoping to see that that's what really changes, that they open it, and most states have opened it to all of the groups. And when you read, I keep forgetting to do this. I can't do two things at once, I guess. Meeting the needs of all. So when you read the instructions from the they really include every young person. So have all of the eligibility conditions to the broadest group and go all the way up to age 21. That's what they really wanted when they put this out. And it's all about creating a really flexible program that helps the young people build their social capital, which are those relationships that are really going to be there for them in many different avenues of their lives, and how you can do that, and not necessarily exclude certain segments of the foster care population. So one thing, Chapin Hall put out a report about what they call subpopulations, and mostly it's about those young people that are most vulnerable, who are going to really have a hard time making it on their own. And when they're talking about that, one group that I think sticks out especially is there's young people who are parenting. That's tough for anybody to really be successful, to go to school while you're parenting. And if these young people don't have that kind of support, to me it's something the state could really, sort of the low-hanging fruit, they could work with that group and help them to be successful in many ways. And we have a lot of other young people who are struggling. So you have some of the JJ group that have a larger challenge when they go out and try to be on their own. You have young people with substance abuse and mental health issues. There's just a number of different groups that when you're looking at implementing this program, it's not about kids, young adults going out of school. I think most of us want to do that. But these other groups, how do we really support them? How do we really work with them? Those are going to be the ones that really need a lot of discussion, a lot of partnering with other people. So really when you look at foster care now, what it has been, the policies and practices we have in place just aren't going to work for this group. These are adults. You're now going to be working with adults. We wouldn't even really in most states call it foster care anymore. It's really a different program. We're using that today because everybody knows what we're talking about. But to make that change, all of a sudden that these young people that you're working with are adults, and how you interact is going to be totally different. And you really have, we always talk nothing about us without us, and having young people in on programming. But this is like even a step beyond that. I mean, they should be saying, here's what we need, here's how we need it. Let's work together. They be the leaders on this. And it's essential, especially for those higher risk, more vulnerable youth, hearing from them what they think will work. What would I like? What would make me want to be in this program and stay connected? So it really has to change. And I know initially when I was there, when this first got approved, differences to do that. So it really changed. Place enough. As I said, it used to be, you had to be a licensed place to stay. Foster home, a group home, but they were all licensed. And that was super different. Now, they're talking about, really take a look at it. And what would you know, any young person, 19 to 21, where do they want to go? Most of our kids out. It's just that sort of transitioning period when so they have now expanded Title 40 funding to cover an independent living place with supervision. So these young people can have a caseworker, they meet with them once a month, but they can live in their own apartments, they can live in a dorm, they could live with in a host home or a relative home, where they really be taken care of. So it's a big change, and all of a sudden, these young people are out there on their own, but they have that support. They have the person to call, and they have somebody helping them make those connections. So this change in living arrangements is one of the real crucial changes about what it's like after
I was told once, don't know by who, so I can't really leave a footnote, but that foster youth age out while the rest of the youth grow up. So what this does is it allows foster youth to have the ability to grow up and become productive members of society. I mean, youth need living arrangements. They need money to make it out on their own. Statistically, 1 in 5 will be homeless by the age of 21. This strikes those statistics out. I was one of those youth. I was homeless at the age of 17, 18, and it really sucked. It was really hard. I worked hard to get away from being homeless, and it took a lot of blood, sweat, and tears to do it. And to keep you from going into the negative light, in order not to be homeless, in order not to be starving, not to be cold and wet, we need to implement this. And how do we implement this, and what does it look like on the professional end? On the professional end, we have to see the youth as adults, because one, they won't be, majority of them, what our discussion was in Omaha with our youth and our panels, is if it's something forced, they're not going to want a part of it. So we have to make sure it looks like it's something that they can do, that they can opt in or opt out and know every aspect of it. And us as professionals have to help them along the way. You can't say, oh, you can't be with this person because they're not on your visiting list. No, you're an adult, you can be. And what we're going to do is we're going to show you and help you and lead you in the directions so you can be productive. We're going to, if you want to be back with your mom and she may have abused you and took advantage of you at one point in time, that's your decision as an adult. And then us as professionals, we have to show them that this might not be a healthy relationship. How do we make sure that the youth are able to do that? How do we implement these things? And we have to look through the eyes of the youth. And that's why I'm here, is to help you guys look through the eyes of the youth. I don't know if I'm going over anything, but okay. Sorry, you guys. So it's not like foster care is a scary word. When I first heard it, I was like, foster care? There's no way. I would say no. When I was 17, you said extending foster care to 21, so I have to be in this foster home until I'm 21. It's not that. So when I bring it to my youth, I say we're extending services. You're getting the money that might go to your foster parents. You're now able to. How do you solve that? Does the state take care of that? Or does the foster parent push you out? And what happens then? Because we're here to help you until you're 21. If you get put out when you're 19, where does it go then? And then what are the different places they can be? Can they stay in a group home if they're in the middle of a program? If they're about to, or what have you, that it is a program that they can graduate from, but now they turn 19, so now it's time to shift them out. Or do we allow them to stay until they graduated, if they're close to graduating it? And then once that happens, where do they go? How do we get them there? And then, anything else?
I'll put you back in. A few things I just wanted to piggyback on. The one place that the youth can't live and be in the extension is with a parent. That's the only place. Other relatives, yes. And we know most of these young people are going to want to try it back home. And so that's the time when they might have to step out of the program and step back in. And as far as a placement like Boys Town residential, every state's making their own decision on that. It's really up to the state of what they're going to determine is a supportable placement. And young people can certainly stay in their foster homes. And I, for one, would say if it's a good placement and you're comfortable, you know, our maintenance payments to foster parents, not going to do much. They might pay rent if you're splitting a place with someone, but to cover all your costs, you're going to have to be working, or you're going to have to be in a dormer. So there's a lot of things to talk over with the young people as they're starting to make these decisions, and where might be the best places for them. But I think what Jake said, and is really important, is the whole voluntary basis of this program. So what is part of this program is voluntary agreements. And when the young person starts the program, whether it's 19 here or 18 in another state, for me, one of the most important things is that there is a voluntary agreement signed by the young person and by the agency. And it would really state what's all involved, what's going to be provided to you, and what are the absolute expectations you have to meet to remain eligible for this program. Have it all very clearly signed out, because the young person, once they sign a voluntary agreement, which means that it's a voluntary agreement placement, they become their own guardian. So they are now their own guardian in that program. It's no longer that we would be going and asking the parents a question. Do you have something?
Yeah. But how about a youth who gets SSI? Would they not qualify for this?
They might not. I mean,
because the services is different than the food.
right. And so there's all those questions you have to consider. And that was if the young person's getting SSI, how does it impact this program? When if they go into a voluntary agreement, and certainly all states want to maximize Title IV funds. Up till now, states have been doing it with their own funding. And so when they come in and if they sign a voluntary agreement, they become their own guardian, and the qualification for the 4E funding is now based on their income. So, wouldn't preclude them if they're an SSI that they could be in this program. They might not get 4E funding for it. So you could have some state-funded young people in this program as well as 4E. But that's a very significant change. 4E eligible young people, children have gone down year after year because it's based back in 1996 or whatever on the poverty level. And so we've seen fewer and fewer kids being eligible. But this, based on most 18 or 19-year-old foster youth who don't have much of an income, just about all of them are going to be 4E eligible. And you don't have to establish that. You don't have to, normally when they're younger, you might, or in other places, you have to reestablish that they're 4E eligible. Once you do that for this program and they remain in the program, then they stay 4E eligible. So if they start making money, it's not going to impact that, so that's a good thing. If they leave and re-enter, then you may have to, but not necessarily. We'll talk about that too. So what are people doing around the country? The one area that I was just kind of surprised by when I talked to them is DC. Youth are really mandated to stay in foster care until 21 in DC. You can't get out unless you can prove that you're very self-sufficient. I was very surprised by that. But other places, Illinois is working towards it, so they hope to have all of the young people sign a voluntary agreement at 18 by 2013. Massachusetts, Michigan, Tennessee, and Texas all of the young people at 18 sign a voluntary agreement. Minnesota does it when they re-enter, and other states may have a combination of some type. Even the ones that they're looking at, well, if they need to become 4E eligible, we'll definitely have them do this. If they're not 4E eligible, they have maybe a slightly different form they sign, but they're tending to use this. And it not only establishes for the young person, here's the services, the expectations, it also sets it up for everyone else. The caseworker, this is a different thing. This is a voluntary, they want to be in this program, they're agreeing to do certain things, they're adults. The courts, it sets up for everybody. This is a new program. It isn't just an extension of foster care. So to me, it's a very important document to develop. And the other important part is the maintenance payments coming directly to the young people. And no one's required to do that. And a few states had already done it for a state-funded program after 18. A lot of them hadn't. But the important thing is we don't want our young people staying until 21 and being no more prepared than they were at 18 to go out and live on their own. So unless we start having them have an income and having to pay rent and having to buy food and having to do all the things that they have to do, they're really not going to learn what it takes. And so we need to start allowing them to handle their own responsibilities, including money. So it's a good way to do it. Now, not every young person's ready. So you may have workers or agencies. I know in California they have a form that you fill out for, number one, is this person ready, young adult ready for receiving maintenance and being able to budget? Number two, are they ready to be out on their own in an independent living setting? So there's ways to sort of judge that and determine. So the states that currently allow direct payments to young adults are all of these: California, D.C., Illinois, Maryland, Michigan, Minnesota, Tennessee, Texas, and West Virginia. So they are the one, and any other one I've talked to has said, we'd like to. We want to talk to some of the states that are doing it. It seems to be more of a systems issue. Important that we start to treat them as adults and give them those responsibilities and not just continue what we've done before 18. So reentry is a very, very important part of this program, and they've mentioned that. There's something called trial independence I won't go into, but it helps to keep for eligibility open when the young person comes back and within 6 months, or if the court gives permission, it can be a year. And they didn't have to start the system on this one. So I tell you what, basically the eligibility for 4E stays open during that time, and they're allowed to come back and you don't have to reestablish anything. But what's really important is the reentry, knowing that most of these young people will want to tell us goodbye. And say, I can do this as well as you can do it on my own, and they're going to want to go out and try that and see what happens, and then they're going to want to come back because life is tough, and it's really hard for any young person of that age to support themselves and do it on their own. So the other question is, do they get to go and come back anytime they want to? And one thing I always think about is our children, they'll often leave and come back and leave and come back and leave and come back. I mean, it's sort of what real life is about. But many states are looking at this in different ways. There's some that are unlimited right now: California, Massachusetts, Michigan, Tennessee, Texas, and West Virginia. Illinois, which makes sense, and I think most people would do this anyway. When the young person wants to come back, you sit down and talk to them and say, what have you been doing? What were the challenges? What are your issues? And they might say, well, I just need to have funding for this, some need they have. And there may be a program that's going to fill that need for them. And other than that, they really don't want to get back into this whole thing. So you would discuss, and really caseworkers are going to have to become very knowledgeable about adult programs, what is available, and making those decisions between should you move over into an adult program type of thing, even if you're in extended care, should we pull that in, should we not? How does that impact your maintenance payments and those sort of things? So it's going to become, every state I've talked to says, if you don't sit down with your adult services in advance of starting this program, you're going to keep hitting roadblocks and issues and trying to figure out what impacts what. So if they're getting a maintenance payment for being in extended foster care, does that impact, is that counted as income for other programs and all of those sort of things? And those are questions that states are answering as they go. So it's really good to sit down and talk with other agents, other stakeholders. Illinois has that assessment. Minnesota, because they're a very strong or fairly strong county-run program, the counties have some ability to say, no, we're not going to fund something or not. So if the young person is a state ward otherwise terminated, they automatically are eligible. But by county, they might not be if funds aren't available. Now, when I talked to them just last month, they said, we're changing that. Everybody will be equal, everybody will have the same eligibility. And I can't imagine that would stand that way for very long. And New York allows them to return within 24 months of discharge and with only 2 times. Only 2 times during that period. So that's the way it was before. A lot of the programs that I'm talking about had these programs like New York that was pretty robust. It was there. It had a lot of policy sets. And these are the states that implemented quickly, and they just kept things pretty much the same because they met all the requirements for the program, and they hadn't, at that point at least, really sat down and talked through all of the options, and a lot of them are now going back. And that's one thing I think every state has to realize. It's got to be very flexible. This is going to change and rechange, and you're going to rethink something after you do it. Young people are going to say it's working, and so it has to be a pretty flexible program. You want to input on reentry and
Right. Well, like you said, everybody, back to. I didn't have anywhere to go back to, nowhere stable to go back to, and unfortunately, the state took on becoming their parents. So when the youth need that support, you need somewhere to come back to. And so I think, maybe my personal opinion, what the discussion has been, is that reentry should be open, but maybe limited, because you will be wasting resources if somebody's just in and out, and not using the resources. So, I mean, maybe the 2-3 strike thing, but there should definitely be reentry, maybe some assessment, is what our discussion was, and hope.
So one of the issues on the reentry is how many times, what's it going to take to come back. But the other side of that is, so they're in your program, they're in the extension, they're working, and they lose their job. How long before they're out of the program? I mean, this is tough. In my discussions with mostly, I felt it was the agency's responsibility to have a lot of options out there. So having a lot of different career programs out there that they could hook into, making sure that all types of educational programs that they could get into, that they're well aware of those, and that we have special ways for them to get into them and to be considered for them. But coming from Michigan, where unemployment is really, really tough, I have a 16-year-old niece who was actually adopted out of foster care, but she applied for every job in the world. And adults are taking those jobs in Michigan. So there was no, she finally got a job at Little Caesars. But what I'm saying is she did everything she could. So how could we penalize her and not let her stay in this program? So we've got to have something that we can say, yeah, well, she's going to career development classes, or she's volunteering. We've got her volunteering this many hours, and she's doing these different things. So that's a really essential point of what can we do to keep them eligible, because it's going to be hit and miss for them if their job just disappears, and what are they going to do? And then there's the one thing about this is if you're in college or school, you have summer break, you stay eligible. That doesn't. So in some ways I say, well, so if you're in school, you get 3 months off without that expectation. So if you lose your job, can you get a little vacation? I don't know. And to be honest with you, the nice thing about this is that truly the Children's Bureau wants states to try it different ways. They actually want them to say, oh, let's try it this way. Is this working? And I think then in a couple of years they're going to come back to all of us and say, well, what didn't? Okay, we're not going to allow this, or we're going to allow this, or we're going to expect this. So it's going to be interesting where this all falls out. A very big part of when I've talked to states about the program, one of the obstacles was court costs. So that the court time, the additions to the dockets, the representation, all those things that are going to cause some cost to the program could sometimes be a barrier to starting it. So there's some leeway in instructions on that. It says actually there's no stipulation for any age that they have to go into a courtroom for a hearing, which I've never heard before, but it's in there. And it said, but there would have to be a hearing before a court representative, someone appointed. So I think that was more or less about this program and how you might change things. Because a lot of young people are very clear that they don't want to go to court. This hasn't been a nice experience for them in their lives. And a lot of them say, I never went. I only went in the courtroom a couple times, and the whole time I was in foster care. Or when I went, I felt like, I was on spotlight for what am I doing, and am I in trouble? It was not an inclusive kind of a process. They didn't feel heard, and they didn't feel involved. And so they're like, wait a minute, if I'm staying in this program and I have to go to court again, I really don't want to do that. So that's been a big issue for a lot of young people. And so there are other ways to do it, and really trying to talk to young people about what they want. We need to keep the agency accountable as much as we're going to keep young people accountable. And so that's one thing that court hearings do. It keeps the agency accountable for providing services and supports that are needed. And so many states already had court hearings after 18 if they had that program till 21 in place, and they kept those. And then there are the states that didn't have that, and also I would talk to them and they said that's getting fortunate that we didn't have it. But either way, if you're going to have the court hearings after, when these young people are now adults, it's got to be a very different sort of hearing. It's now an adult in the courtroom who should have all the rights that any of us walking into a courtroom would expect. The whole idea of the attorney going from really proposing what they feel is best for the best interest of the child. That's sort of, they listen to the child, but then they put out what they believe is in the best interest. Now have to be client directed. This is an adult they're representing, and that's the voice that they should be putting out there in the courtroom. And so people are looking at, does it even make sense to have a GAL? I mean, that's not what it is anymore. So how do you change that whole idea of this type of court hearing? And that's what this is really addressing is how do we go from that to a whole new thing, and what's a court hearing supposed to look like? But the young person needs to feel empowered, needs to feel it. I have to walk into court. Number one, I don't want to feel like I did something wrong, and I'm in court because I did something wrong. But number two, I want to feel that I'm a really important part of this process, and people are listening to me. And if I have issues, that's what's put out there. Certainly, if they're causing issues, that's going to be out there too, and I don't think that would be a surprise to them. But it's an area that I haven't heard a lot of discussion in the States about. It's just now starting to come to that realization of, this is going to be different for all of us, and how do we do that? One state, California, put in their act that the reviews will be conducted in a manner that respects the young youth's status as a legal adult. So it's actually in their legislation. So they're trying to make sure people understand that.
In our discussions with youth, the youth were, like she said, the youth were negative towards having to go to court. It's something they have to do. It kind of takes away from it's an option, and it kind of makes it mandatory when you have to go to court. And it's a cultural issue, because in a lot of culture of the youth from the area codes they come from, at least in Omaha, that it's a serious issue. They think about, courtrooms, they think about police, and they think about going to jail, and it just causes stigmas. And like I had one, I still don't like going to courtrooms. I have to go pay a traffic ticket as a former Flush youth, and a juvenile delinquent, when I would go to the courthouse, I would end up going to jail a lot of times. Well, not jail, Douglas County youth center, and or placed in the group home. And that's what comes with a lot of foster youth. They associate courtrooms and judges with going into foster homes, going into group homes, going into detention facilities. So it's that's going to be a big hurdle to get over with our youth.
Thank you. So one thing I will mention to you, Michigan hasn't had their plan approved yet, but they looked at part of the instructions that mention that if young adults are in foster care under a voluntary agreement, that the permanency hearing is no longer required, that there does not have to be a permanency hearing. Permanency is still paramount, but there doesn't have to be a hearing. But there still has to be administrative review. So they are actually having the young person, the court has to make a finding that it's in the best interest of the young person to go into extended care, voluntary agreement. Have that, what Michigan's actually doing is having a hearing to close the abuse neglect case, having a hearing that ends, and then right at the same time having a hearing to open a voluntary placement. Legalized, and saying it's in the best interest, then the court closes their case. And the court will be out of 18 in Michigan. Now, if a young person is in voluntary care there and then leaves and comes back, the court again has to make a best interest finding unless it's under the trial independence maybe. I'm not sure about that. But again, so they would make that finding and close the case, and there would not be a court case open. I'm from Michigan. This came up after I left, and I'm leery, only because of accountability. I'm not sure who might be able to make sure that they're coming through with what they need for the young person. But I think there's a way to do it. Other types of ways to look at this. They've got to do administrative reviews. Everyone does administrative reviews on the cases. And so it depends on who you have doing that. So one state, I think I have it on the next slide, does a review by the Foster Care Review Board for every case over the age of 14 in the states and the court hearings. But you could do that, that Foster Care Review Board review for these cases as an administrative review. And that would hold, there would then be some outside person still looking in to say, is the agency providing what is needed? And so I think there's ways that you could make the accountability without necessarily having a court hearing. And so that's the one that has to reviews by the foster care review for 14. So they could morph that into taking on that role. So the court is a big issue, and I think it has to be looked at carefully, and certainly use voice about, does this work? Is this going to make it less we want to continue? Is an important discussion to have. So permanency hearings may not be required if they're in voluntary care, but it's very clear throughout this, the instructions from permanency is now. I think what we have to start understanding after 18 by the young person. They're going to be making those decisions. I was presented with two young women. One had gotten adopted after age of 18, and the other one felt like she was. She had become very involved, very close with her minister's family, and she felt that she was part of that family. So when I talk with the older youth, often they're the ones that are finding these really important connections, but we have to then be there to do everything we can to ensure, number one, that it is a positive relationship for the young person, and that they understand what all is going on, and number two, that we're doing everything to encourage that and to support that and to bring that into what is best for this young person. But beyond that, really, family type of permanency, which is number one. I don't know how to call anybody that sit in the world without that family type relationship there for them every day of the week. But they also need all those other kind of relationships out there. So relatives that could be out there to be there for them in many ways. One of the interesting conversations has been, so they're 19 or 20, and they want to live with their boyfriend. And what's the state going to say about that? I know in Arizona, they'll get married and stay in the program. So it's a wide range of what are we going to be comfortable with, and how are we going to really acknowledge this is an adult relationships in many ways. They're going to have boyfriends or a significant other of some sort. And are we okay? And how, because you don't necessarily want to leave some of these things up to individual caseworkers who may or may not have their feelings about these things. So it will be there whether we're talking about it or not, and people will be forced to deal with it. But it's always important to remember that it's an adult situation now. It's not the 16-year-old that we dealt with before. Okay. So when I've been talking to most of the states and really asked them what are the issues that are challenging them. And one of the things is what I was just talking about is how do you develop policy and programming and guidelines that allow these young people to be young adults, making decisions, making mistakes, having issues, and not have either the caseworker or the foster parent or whoever feel that, oh, if they make mistakes, something happens, I'm going to be on the line. So you can tell me all you want, this is a young adult, but I'm going to be really uncomfortable because I'm responsible in some way. So it's a real fine line of saying, and I think it was Texas wrote a guideline, I have it in the resources, a guide for working with older youth, and a couple other states have. And one of the things they say over and over again is, not over and over again, they only say it once really, but is that we're not going to hold you responsible for that. If they make a mistake that any young adult might make, we expect you then, of course, to go in and talk to them about it and help them figure out what they could have done differently and all those normal things that you would do as any young adult. But it's not going to be you're in big trouble because this young person went out and stay out all night or alcohol or whatever. All of those tough issues and how you're going to deal with them is going to be. They also the individual cases of what's going on and why things happening, and maybe you get walked in a regular mistake that we're not going to walk in every time, this kind of thing. So it is a different program, and people have to be looking at new issues that are going to come up. I think it's really exciting because they are young adults, and they're really learning things, and they're really trying hard, and they can respond so well to resources and to supports. Some of the resources that are out there, I will say, California did a killer job on this program. I've never seen anything like it in my whole life. In a year, they had subcommittees all over the state. They met about everything. Were involved in every decision. It was the most thorough development of a program I've ever seen. So because of that, they have many, many things online that don't recreate the real because they've got training, they've got lots of things that people can use. I know I would. But the one thing they do have is that whole thing about how do I know when who makes a decision the young person's okay to go out and live on their own. They do have an assessment on that. Texas, that's what I was talking about. They have a whole written document about working with older youth. And they also have rights and responsibility. Indiana wrote an RFP that not necessarily the music department, but the language and the outcomes and everything in this document, yeah, I thought it's one of the best put together I've seen. So it's a good resource. some of the lessons learned. Again, I think I said it before, involve and educate all your stakeholders. Don't put this program into place also didn't realize that we're going to impact people. And then, educate your public. Some of these young people are probably going to have some issues. Let the public know what's going on, and that you're allowing these young people to be young adults and really get that buy-in and support from the community and have them work with you. And again, include all agencies, which you're kind of doing here today. So I think it's pretty normal for you. But also we want to talk a little bit about what's going on here, what's happening in Nebraska. And Sarah Hanley will come up and let you know that.
Good afternoon, everyone. My name is Sarah Hanley, and I'm a staff attorney and director of the Child Welfare Program at Nebraska Appleseed. It said my task was just for a few minutes to come up and update you on some exciting things that are happening in Nebraska. There's been a lot of momentum and work on this issue, and so I want to just go through that really briefly. But before I do, when you came in, the fabulous Amy West, raise your hand, should have handed you a survey. Please put it on top of your pile. This is an opportunity for you to give input. As you heard from Kate and Jake, there's so many decision points when the state is looking at implementing a program like this. Do we want to have court hearings? Do we want to do it a different way? Do we want to provide stipends directly to youth? This is an opportunity to provide input. It looks like a lot of words. Really, the questions are in blue, and because you all have a lot of background information, you don't have to read everything unless you want to. The information underneath each question in blue is a little bit more background information about the pros and cons of the other options to help you kind of think through it. So I'll talk through this a little bit more about what this is all about, but I just wanted to have you get it out, and maybe if there's time at the end, or you even want to stay after class, Amy will be in the back to pick them up on your way out. Appleseed also has a resource booth in the hallway, and we have a big colorful box that you can return the survey. So please, if you would be so nice to do that, we sure appreciate your input because it is so important to have stakeholder input. So backing up a little bit, as I said, there's been a lot of progress in Nebraska, a lot of work done on this issue. There is a typo on that slide that maybe Senator Campbell or others are referencing. There was a bill introduced, it's not LD 1063, that's a Medicaid bill. Sometimes I get it mixed up in my head. It's actually LD 1150. It was introduced in January, this past legislative session, by Senator Amanda McGill. And it was a bill to create a program to extend services and support in Nebraska to youth to age 21. And it had a good hearing and a lot of positive response, but it did not advance out of committee this year. The legislature was busy with a lot of child welfare issues. And so since that process, work has continued. Thanks to the generous support and expertise of the Jim Casey Youth Opportunities Initiative, the Nebraska Children and Families Foundation convened a group of stakeholders to talk about programmatic design options that Kate and Jake talked about today to start that conversation. And that group came up with a few different models, and then some national consultants from Mainspring Consulting Group, they've done fiscal analysis across the country, did a fiscal analysis of what it would cost to do a couple of different models for Nebraska. And so we have that information. Kate talked a little bit about the federal drawdown that helps to offset cost, but there is an investment there. Research, though, has shown that providing continued services to 21 youth who continue to receive services fare better on a range of measures than those who don't, and that providing those services also saves money in the long run, yielding approximately 2-to-1 return on the investment. See here. Click through. So the last point is there that the focus from the stakeholders that have been that were a part of that conversation was on a voluntary youth-led system of extended transitional services and supports in Nebraska. Let me just mention some of the organizations that were involved. Project Everlast, young people were involved very much in that process, and maybe Jake can mention a little bit more about that. HHS, NFC, Foster Care Review Board, Mediation Center, Court Improvement, Central Plains, CASA. I'm probably missing some others. And also I should mention that the department provided data to the national consultants to help us come up with those consultants come up with the numbers for the fiscal analysis. So it's been great to have everybody, a number of groups together in that process, but that's why we want everybody to provide input through the survey and as the process continues. And so then during the, after the legislative session, Senator Amanda McGill introduced an interim study, LR 537, and you can see there on the bullet, the interim study is, the intent is to gather data and develop recommendations on the unmet needs of and gaps in services available to youth who transition or age out of the foster care system. And so this has been a busy summer already as part of that interim study. Representatives from Project Everlast, Nebraska Children and Families Foundation, and Appleseed conducted focus groups with youth, and that's what Jake was mentioning, I think, some of the feedback that they got from youth in the Omaha area. Focus groups across the state in 9 different cities. There was a focus group in Lincoln, Omaha, Grand Island, Scottsbluff, North Platte, Norfolk, the YRTCs in Kearney and Geneva, and then at the Project Everlast summer convening in Marquette, Nebraska. And so that was a great opportunity to hear from the youth as part of a focus group about their thoughts, and we're collecting all that information as the process moves forward. There's also a survey of youth that's similar to the one that I'm advertising today for stakeholders, and we have heard from over 100 youth have completed that survey. We I think have some preliminary results from that also if you want to visit our booth. And then the stakeholder survey as well. The information from these processes are all going to be compiled and reported as part of that interim study, and so that will go to the legislature so that they can better understand what stakeholders and young people primarily, what their input is as part of the process. There's also going to be a hearing as part of that interim study on October 25th from 1:30 to 3:30 at the state. So I think then I will turn it back over to Jake to give his perspective, maybe more about the youth as part of the focus groups and their input.
Well, the youth's overall responses to the questions that were asked were they're for it. They're strongly for extending services to 21, but they have fears, they have questions about it, and those questions and fears need to be addressed. And overall, it's a positive thing. I think it's a positive thing. Overall, we came to the conclusion that was positive. The money that would possibly go to them, the insurance that they will have, is huge. I mean, some of the stories we hear are youth not being able to go to the doctor for serious things. Like, I'll draw from my own experience. When I was 18, I tore every tendon in my rotator cuff. Then you go to the hospital, then you have insurance. I mean, and this program provides insurance for them, that they have one less thing to be worried about. They can become productive members of society through this. But how do we keep them from becoming dependent on it, like we see in our welfare systems, where we have generations after generations living in the housing projects and food stamps? How do we keep them from, when that money comes that their foster parents usually get, when that stops coming at 22, how do we have them transition into where they can make it on their own, where they can pay their own rent now, where they can feed themselves now? How do we do that? Who has ideas? You can raise your hand. Who has an idea on how we would implement that? Oh, we got a shy group. We got a shy group. We got 7 people and they're all shy. Well, what some of the feedback is that somehow we can wean them off of it almost. Is the best. I had that discussion with my brother and then a few other youth. Is that if the youth slowly, you gotta earn more, you gotta make more comes to you. Now the groceries are starting being paid. Now you have to provide yourself with groceries. Now you have to, and then a few months later you have to, start putting your own gas in your car, and then maybe that grant gets a little smaller. I don't know if that is really an option, but that's something that the youth did discuss, and the youth were open to. In some of the first sessions I had with the youth. Was there anything you wanted to add to this?
I'm just going to do the last slide. I think we're just about out of time. I'll open it for questions. So the last slide is just some other resources. Oh, that was on there, wasn't it? Yeah. One that's not on there is the Jim Casey site, and there's handouts at the Project Everlast booth, and they're just constantly putting out really important issues. They have one on trauma-based programming that just came out. So that's www.jimcaseyyouth.org. Pretty easy, just so you know. But there's more and more coming out about it, and certainly as anyone who's worked on anything, it's always good to use what you can from other people. So I did want to open it. We're just about out of time, but we probably have 5 minutes if there's any questions or concerns. Yep.
Of the states have adopted this extended services. Okay. Of the states which have adopted the extended services, can you tell me any of the states' percentage of youth or young adults who signed the voluntary agreement and participated in such services?
I asked the states that when I called them, and not too many have data yet, but I know Minnesota saw a significant increase, I think. They were talking, they said before they did this extension, they had extended, but youth were basically discouraged to sign up. But I think they had seen 500 youth in the first year sign up, and they thought that was a very significant increase. It's all about, number one, how it's presented to them, right? Is this good for me? I mean, in my mind, it's a no-brainer, but it's not going to be for them. And so really, how positive are we when we talk to them about it and show them the advantages of it, and the fact that they can leave if they want to? It's not, that's really the key, I think, and that training to staff and whoever are going to be really working with these young people, that's the most important part. And of course, the best relationship with the worker is going to be key, because that's the person you want to keep in your life. That's a good relationship, right? So, so I now many people have gotten to the point where they have the say, how many more, or only 3 or 4 of those people are like starting a new program. Really. So the other ones already have almost all their youth staying in. So they won't probably show a big difference. But it's, as we start with Michigan and California, those are the ones who are going to tell us how many people stay in. So we're just starting.
Just a comment, it seems like the social capital issue seems to be really important to help prepare young adults way before they turn 18 or 19, but to help them develop that social capital and prepare them for those kinds of decisions. We see that in the behavioral health field. When we can engage young people who have behavioral health issues, if we can get them engaged in understanding what they're working with, they're just much more willing to continue to be engaged in support.
I think that's the key. And for me, my prayer is that when we realize we're not going to use people to 21, we'll do a hell of a lot better job starting at 14 to prepare them for that. In a lot of ways, I think we think, well, 18, we're done with them, or 19, we're over that. So we've done really, I think, really, depends on the state, but not a great job of getting them prepared. But now we know they're going to be with us till 21, so let's get smart, start early, and build social capital, really help them understand things. And then when they're 18, they're going to be able to be on their own professional than they are now, that's for sure. So, but I do think that's key. Any other I mean, I know you probably have a million questions we'll do for the state. Yes?
Do you know how California is paying for their program? Because everything I hear about that state is that it's broke.
It was like to do the year-long.
Yeah, you said they had it.
Yeah, it was amazing.
All
All private,
figure that out.
all private foundations.
Oh,
Nothing for the state.
there you go.
Pretty amazing, pretty amazing. Yeah, so get those private foundations all set up. Sorry. The one thing I like about California doing it, they did it for all of us, in my mind, is they put it all on the internet. So their work will help everybody else. Well, I appreciate it, and I'm just waiting for the day